It is a great satisfaction to greet you, and I hope you find yourself well, both you and your pet. In today's video we will talk about the following. How do you know if your dog has worms? Let's find out now. One of the most common concerns of any dog parent is whether or not their dog has worms. As gross as it may be to think about it, pinworms are pretty common. So, we will talk about how to tell if your dog has worms, how dogs get worms, and how to get rid of worms in dogs. 1. How do dogs get worms? By eating feces. Transmission of intestinal worms, hookworms, roundworms, and whipworms commonly occurs when your dog ingests contaminated soil or feces containing larvae that have been passed from other infected animals in the environment. They also get it from his mother. Pregnant and lactating bitches can transmit larvae and roundworms to their puppies during pregnancy if the larvae migrate through the placenta. These larvae can also migrate to the mammary glands and pass to the pups during lactation. Hookworms, like roundworms, will eventually grow to maturity in your dog's small intestine. They can also ingest fleas during grooming. Your dog could become infected with tapeworms by licking himself during grooming or chewing on his fur. Fleas transmit tapeworms by ingesting tapeworm egg packets in the environment before jumping on your dog for a blood meal. Once the flea has been swallowed and digested, the tapeworm larva can attach itself to the wall of your dog's intestine and grow into adulthood. 2. So how do you know if your dog has worms? Since worm infestations can sometimes show few or no symptoms, keep an eye out for any or all of these changes in your dog's daily health and appearance. Diarrhea, sometimes with blood or mucus. Vomiting, which can sometimes contain adult worms. Weight loss, especially if your dog has a good appetite. A bloated belly or a generally unhealthy appearance. A dull and dry coat. Sliding in its lower part is excessively masticated. Visible segments that look like grains of rice adhering to the fur around the tail or on the tail, or in feces. 3. Common types of worms and their symptoms. Here is a list of the most common types of worms in dogs and the specific symptoms you may notice for each. The whipworms. Adult whipworms are smaller than roundworms and can be seen with the naked eye, but are rarely seen as adults in feces. These worms can cause chronic weight loss, diarrhea with blood and or a layer of mucus visible in the stool. Hookworms. Adult hookworms are usually not visible to the naked eye. Hookworms can cause bloody diarrhea, anemia, soft spot, lethargy. Intestinal worms. Roundworms are visible to the naked eye. They look like spaghetti and can be seen in stool or sometimes vomit or cough as single worms or in groups. Can cause diarrhea, weight loss, lethargy, a potbelly appearance, a boring coat. You had them tapeworms can look like grains of rice in your dog's coat or can be seen with the naked eye in longer segments. Can cause excessive sliding, that is, the dog crawls on its rear. Itching. The rear part is chewed. 4. How to get rid of worms in dogs. This is what you should do if you suspect that your dog has some type of intestinal parasite. Call for a veterinary appointment. If you think your dog might have worms, you should make an appointment with your regular vet right away. If left untreated, intestinal parasites can migrate to other organs in your dog's body, including the heart, lungs, liver, eyes, and brain, potentially worsening the disease and even death in the most severe cases. Collect a sample of your dog's stool. Your vet may request a fresh sample of your dog's stool, especially if you see worms in his stool or notice dry, rice-like segments on his fur. Once your vet has had a chance to examine your dog and analyze the fecal sample, he or she will determine the best type of deworming medication to treat any worms present. Your vet can prescribe an oral or injectable dewormer that will kill the adult worms and larvae. They may also recommend starting your dog on monthly oral or topical flea prevention, as tapeworm infections can recur if there are fleas in your dog's environment. Would you like to have more professional information, and especially updated about your dog? Visit the website below in the description of this video. Do not stop subscribing to the channel, comment, and share the video. You are very well, thank you.